This is Deborah Jennings from the Center for Parent Information and Resources located at SPAN in New Jersey. And I want to welcome you to today's webinar, where we're going to be talking about collaborations that promote developmental health for young children. And we're going to hear from some ACT Early ambassadors and parent centers who are working together in their states. But first, just a little bit of the sort of etiquette and so forth. So we'd like for you to share information about your organization, your state, and your email address. And there's a box at the bottom of your screen in the left-hand corner where you can just type in that information and hit the little button, and we'll be able to follow up with you with further resources as well as to get your feedback on our evaluation. Also, just the way our webinars work, we'd like for everyone to really be muted. We are going to mute everyone, but as you're arriving in the room, please make sure that your audio is on mute. We will have an opportunity for questions and answers, so feel free to use the chat box to type your question at any time, but we'll have a couple of breaks where we'll have a chance to review the questions and hear some responses from our panelists. And if you'd like to ask your question live, there's a little icon at the top of your screen with a little person holding up their hand. If you click on that, it will raise your hand and we can recognize you and make sure that you're unmuted. So let's begin. We have a wonderful group of presenters for today. We have from the U.S. Department of Education, Office of Special Education Programs, Research to Practice, Carmen Sanchez. We have from the Early Ambassadors Programs from California, Deborah Sarmento, and from New Jersey, Deepa Srivanarasarada. Oh, Deepa, I do it all the time, sorry. And then from the Parent Training and Information Centers, we have from New Jersey, Diana Oten, from SPAN Parent Advocacy Network, and from California, we have Kelly Young from Warm Line Family Resource Center. And then also from the Center for Disease Control and Prevention, the National Center on Birth Defects and Developmental Disabilities, we have Julia Abercrombie, who is also joining us, and she leads and guides the ACT Early Ambassadors Program. So just quickly to give an overview, we're going to hear more about parent centers, parent training and information centers, and community parent resource centers from Carmen Sanchez. And then Julie Abercrombie will give us an overview of the Learn the Signs and the Ambassador Network. And then we'll hear our presentations from each of the states. First up will be New Jersey, and then they will be followed by the California collaboration. We'll have some time for questions and answers, and then we'll have a little conversation about how other states might engage in these kinds of collaborations. So, Carmen, I'll pass it
Welcome,
to
everyone.
You.
Thank you. Welcome, everyone. This is Carmen Sanchez from the U.S. Department of Education, the Office of Special Education Programs. While my slides are being put up, you'll see a question on your side, which is, if you are an ambassador on this call, how much do you know who the parent center is for your state? So if you're an ambassador, if you could answer that question, that would be really helpful for us. And in a little while, we'll close it out and we'll look at the answers. So let me explain to you a little bit about who the parent centers are and what they do and how they can be supportive and collaborative with the ACT Early ambassadors. The Parent Training Information Centers and Community Parent Resource Centers are there to support families navigate systems. They are funded under the Individuals with Disabilities Education Act, which provides discretionary funding to states, institutions of higher ed, and in this case, nonprofits, because parent centers have to be nonprofits according to IDEA. So IDEA funds a system of parent training information centers and community parent resource centers, which we collectively call parent centers, to help families navigate early intervention and also special education system. They also fund a system, IDEA also funds a system of parent technical assistance. And I'm going to go over a little bit what the difference is between them really quickly. So let me go on to the next slide. In total, there are 63 PTIs that serve states or areas within states. When you hear about California, you'll hear that they have multiple parent centers in California because it's such a big state. But most states, like in the example of New Jersey, have only one parent training information center. We also have, I said 23, it's really 29 CPRCs that serve targeted underserved communities throughout the country, and they're not in specific states. They identified the communities they're going to serve. They're 5-year competitive grants, so different organizations can become PTIs and CPRCs. And as I mentioned, they must be parent-led nonprofits. The majority of the board of directors must be parents of kids with disabilities. That helps ensure that they have a good grasp on the grassroots of what the nature of the experience of parents of kids with disabilities is like. Most organizations that have PTIs or CPRCs also have a variety of other federal, state, or local grants, and you'll be hearing about this in the example of both Warmline and SPAN. And they're well connected to states and to communities. So what is it that they're supposed to be doing? They're supposed to provide training and assistance to help parents understand their kids' disabilities. What does that mean? And what does that disability, how does it impact with their children's educational needs? They help families understand their rights and responsibilities under IDEA and several other laws, including the Elementary and Secondary Education Act and FERPA, which is the Family Educational Rights Privacy Act, and other laws that affect the education of children. They also have to work with families to help them communicate more effectively and work collaboratively with educators and also service providers. They help families learn how to participate in their children's education and early intervention services. And lastly, they help families resolve disputes with schools. So you can see it's a very wide range of tasks that they have to carry on. And I don't have it here, but I want to clarify it's with the wide range of disabilities. So one moment it could be a parent who has questions about their child's development and whether or not their child has autism or another kind of developmental disability. And the next call may be about a parent of a child who is deaf, and the next call may be about the parent of a child who has dyslexia or some sort of learning disability. So they have to serve the wide range of disabilities that children have. Their services can go from one-on-one assistance, picking up the phone, or even going with, in some cases, going with some families to meetings, workshops, a lot of workshops. Most of them now, not most, but a lot of them are now being carried on the web. A lot of publications, and then also their websites are a good source of information services. And the last one I want to point out is they also must serve families of children who are suspected as having a disability. So if you suspect your child has a disability, you are eligible to receive services through the parent centers. The technical assistance centers, because you can see the wide variety of things that parent centers need to do, they help the parent centers more effectively coordinate their parent training efforts. They disseminate research and information. They help them reach underserved populations, and they provide supports to better serve families, including doing things like this webinar, because the CIPR, the Center for Parent Information and Resources, is one of our parent technical assistance centers, doing these kinds of resources to help with collaborative efforts. We have 9, the Center for Parent Information and Resources, 6 regional PTACs, and then 2 that are specifically for parent Native American, to help parent centers support Native American and military families. This is the web page for the Center for Parent Information and Resources. It's an easy URL to remember, parentcenterhub.org. You notice I pointed out to the link that you follow that, and you can get to learn about what are the parent centers in your areas, for those of you who are not familiar with them. And this is just my information about who I am, and in case you would like to get in contact with me, I'm available to talk to you all. I think that was my last slide, and I'm going to turn it over now. And I see that the poll is closed for voting. Let me see if I can get the results of the poll, maybe in the chat space, in terms of whether or not only 4 of you responded, and all 4 of you said you were familiar with your Parent Center. How wonderful. That's really good to know. So I'm going to turn it over to my colleague in the CDC, the Center for Disease Control, Julie Abercrombie. And while she puts up her slides, if you're a Parent Center, tell us if you're familiar with your Act Early ambassador in your state. So with that, I'll turn it over to Julia.
Great. Thank you, Carmen. And hi, everyone. We're so thrilled to be here today and try to foster connections and promote collaboration. So yeah, if you are a parent center or representing a parent center and you know your Act Early ambassador or not, please respond to the poll. I think my slides are showing up for everyone. So yeah, I'm a behavioral scientist with CDC's Learn the Signs Act Early program. In the room with me, actually, also, my colleague Camille Smith is here. Many of you are familiar with her, also from Learn the Signs Act Early. So for those of you who are less familiar, I wanted to give you a brief overview of Learn the Signs Act Early and especially our ambassadors. So our program is really CDC's effort to improve early identification of developmental disabilities so children and families can get connected to the early intervention services that they need. And the way that we do this is the 3 main ways. We develop and disseminate high-quality, parent-friendly materials that are all based on research and designed to engage parents in ongoing developmental monitoring or tracking their child's developmental milestones, and giving very clear and concrete guidance about what to do if parents have a concern about how their child is developing. Secondly, we do a lot of research and evaluation to ensure that our materials are doing their job and are effective. And thirdly, we have Act Early initiatives, such as our Act Early ambassadors. So the materials are being used in systems across the country in primary and pediatric healthcare, home visiting, child care and Head Start, WIC programs, and others. I wanted to show you a snapshot here of just some of the materials that we have. And I think we add new things every year or update and revise them based on feedback from the field and what we learn through our evaluations. So it's always changing. But we do, the core of what we offer are our milestone checklists that we have from 2 months to 5 years that also include warning signs or red flags, messages about what to do if caregivers ever have concerns. Everything that we offer, since we're a government program, it's all free. And it's not copyrighted, and everything is reproducible and customizable. They are in English and in Spanish and in a variety of other languages. And many people find them useful for child find and other outreach activities, especially when they can be customized with local contact information. Some of the items I wanted to point out to you are the new Milestone Tracker app that you can see in the center. That's available on your iPhone or your Android device. We have children's books. We have 2 that are available, one for 3-year-olds and one designed for 2-year-olds. These are free and interactive books designed to entertain children but also teach parents about milestones their child should be reaching. I think another item that would be important for the parent centers to know about are we have fact sheets and web information that's designed to help parents who have concerns about their child's development. So with really practical tips about what to say to a healthcare provider or other provider, how to go about getting an evaluation and other tips. And now to our ambassadors. So besides being a great group of people, they have responsibilities that include being our state or territory representative for our national program. They support the work of Act Early teams or other similar efforts that are designed to improve early identification. So Act Early state teams are coalitions that some states and localities have initiated to promote early identification, and many times our Act Early ambassadors have either spearheaded these groups or they're very active members. So that's something that many of the ambassadors participate in. And then they also just promote the resources, let people know about what the program offers, and work to embed them in programs where they can be meeting needs. So we now have 55 ambassadors. So this has grown from our initial cohort of 10. We're getting close to having an ambassador in every state and territory. They are individuals who all possess expertise in child development, and they have a very diverse professional background. We have some MDs, we have people who manage programs or program directors, faculty at universities, researchers, parent advocates, and others. And they often wear multiple hats in their communities. Actually, as of February 1st, we selected 10 more new ambassadors that aren't even listed yet on the website, but that will be announced later on this week. And you can find our current cohort of 45 ambassadors on our website. You can find their email addresses, and they're on our website here. Finally, I just wanted to share that a few months ago we polled our current ambassadors and asked how they were working with the parent centers. And about 20% of the current ambassadors said that they were connected somehow. And I just wanted to point out a few ways that they reported that you all were working together. So I'm excited to hear from our ambassadors and parent centers from California and New Jersey. I hope that after the webinar today, people are more familiar with Learn the Science Act Early and the ambassadors, and that our ambassadors know more about the mission of the parent centers and how you all can work together. So next I am going to, I think, turn it back over to Carmen to introduce our next speakers.
Great. Thank you so much, Julia. So our next speakers are coming from New Jersey with statewide parent advocacy network, and they are Deepa and Diana. And I noticed in the poll question so far, 92% of the parent centers are familiar with the Act Early ambassadors, but another one person wasn't until now. So we're hoping that the word gets out more so they can work together. So with that, I'm going to turn it over to Diana and Deepa to talk about how the collaboration happens in New Jersey.
Thanks, Carmen. This is Diana, and just want to say that SPAN is 30 years old this year. We are a one-stop for New Jersey families. We house the Parent Training Information Center, the Family-to-Family Health Information Center. We're state affiliates of Family Voices and Parent to Parent USA, and also a chapter of the Federation of Families for Children's Mental Health. We partner with National Family Voices on the National Center for Family Professional Partnerships, funded by the Maternal and Child Health Bureau. And as Carmen mentioned, SPAN houses the National Center for Parent Information and Resources, and also the National RAISE Transition TA Center, funded by the U.S. Department of Education. I think it's clear when you look at our vision and our mission that both serving as a parent center and housing the Learn the Signs Act Early ambassador would be priorities for us. If you look at our mission, we're interested in the healthy development and education of children and youth, and certainly both the Learn the Signs Act Early program and parent centers help families ensure the healthy development and education of their children. We're also very committed to those children and families that have the greatest need and who face the greatest risks and barriers. And so working with the Learn the Signs Act Early program to ensure culturally appropriate screening and connection to culturally appropriate resources is also a high priority for us. Our logo, as you can see in the lower left-hand side, has a bridge, and we try to serve as a bridge between parents and professionals, from parents to the services they need across different systems and also among and between diverse families. I'm going to turn it over to Deepa.
Thanks, Diana. I was already working at SPAN when I was selected as the Learn the Signs Act Early Ambassador in 2014. I love both my roles, and I've continued in both those roles as a SPAN staff member as well as the Act Early Ambassador. The focus of my work really has been to leverage partnerships to ensure that all efforts related to early developmental monitoring and screening are working together in our state to complement each other, maximize impact, and reduce duplication. This allows opportunities for creation of policies and protocols to address gaps and ensure consistency in access to effective screening and development and dissemination of New Jersey-specific, family-friendly, culturally competent tools and resources to meet the identified needs. Building on SPAN's many existing collaborations, I've been able to build and help extend partnerships for Learn the Signs Act Early. Learn the Signs Act Early information and resources are shared by all SPAN projects with families and professionals that they serve. This is very helpful for increasing the reach of the Learn the Signs Act Early materials to diverse audiences while helping the different projects meet their deliverables. Here's a list of SPAN projects that share the Act Early information and resources, but I'm just going to highlight a couple of them as examples. The early care and education providers who receive training through the Inclusive Childcare Project, as well as the pediatric practices that participated in the D70 Medical Home Systems Integration Project that we completed recently, received the Act Early materials. Some of the pediatric practices also included some of the federally qualified health centers. And through the Improving Pregnancy Outcomes Project, community health workers also disseminate the Act Early materials. Now I'll turn it over to Diana. Diana?
Hi, I put myself on mute. Because SPAN is funded by and provides support to families served by all of the New Jersey state agencies that are focused on children and families, there were already some existing collaborations and written agreements between SPAN and these agencies that provided immediate opportunities for collaboration with the Act Early Ambassador. Deepa was already serving as the New Jersey family delegate to the Association of Maternal and Child Health Programs, participating on monthly calls with the State Department of Health, the Association of Maternal and Child Health Programs, and the U.S. Maternal and Child Health Bureau. She was also participating in meetings of our state's Infant Child Health Committee, which is a subcommittee of our New Jersey Council for Young Children, which tries to bring together all the state agencies and issues that impact young children and their families, from education and health and all other kinds of important areas that are critical for infant child development. And because of these existing relationships, there were already many protocols in place between SPAN and these state agencies to ensure that it was very clear the kinds of collaborations that we'd be working together Act Early. Also, DEPA's role as the Learn the Signs Act Early ambassador on our staff helps strengthen our role at SPAN on the Act Early state team. The Act Early state team was mentioned earlier, and in our state it included our University Center of Excellence on Developmental Disabilities, our Council on Developmental Disabilities, our Governor's Council for Medical Research and Treatment of Autism, our American Academy of Pediatrics, disability groups, etc. DEPA actually took a leading role in planning the May 2015 Northeast Regional Act Early Summit that was held in Connecticut and pulling together a state team comprising 13 members from our state Act Early team, and also really encouraging all the Act Early ambassadors from the Northeast who were helping to plan this important summit to make sure that they invited family organizations like their parent centers and family-to-family health information centers. DEPA?
New Jersey had 2 Act Early state implementation grants funded by the Association of Maternal Child Health Programs. They were parent-led training initiatives to increase awareness of importance of developmental screening using validated tools. The trainings were provided to federally qualified health centers and to the Head Start and other early childhood programs. It was a partnership between the Boggs Center on Developmental Disabilities and SPAN, where parents led training and shared their family's journey to diagnosis, and Learn the Signs Act Early materials and other statewide and local resources were also featured. Working with the Act Early state team, several SPAN staff, including me, disseminated the Act Early materials and provided information on red flags in child development to federally qualified health centers and Head Start and early Head Start programs. Through this effort, county-specific and statewide flowcharts were developed. So this slide shows the county-specific flowchart that was developed to serve as a quick reference guide to help families and professionals get started with connecting with important services and supports when developmental concerns are identified in young children. This work was also supported by the early and continuous screening of the Community of Care Consortium, which Diana will be talking about shortly. So again, this speaking about the flowchart, the county-specific flowchart, it lists several important connections that providers should know and help families connect with upon recognizing developmental concerns in their children. A flowchart like this one was developed for each of New Jersey's 21 counties as part of New Jersey's second Act Early State Systems Grant Project. The next slide shows the statewide flowchart of what next steps should be taken by parents when developmental concerns are identified in their young children. And these were disseminated as magnets so providers can have them posted on their file cabinets or other places for easy access to share with families. Next slide is the Spanish version of the statewide flowchart. Diana?
So New Jersey was the recipient of a series of 3 integrated systems grants that were funded by the U.S. Maternal and Child Health Bureau, which were collaborations between SPAN, the New Jersey Department of Health, and our American Academy of Pediatrics chapter. And this partnership was expanded to form a statewide community of care consortium for children with special needs that had stakeholders from state departments and community agencies, Act Early state team members, healthcare providers, parents, youth, educators, and other interested community members who meet quarterly to collectively advance and improve the system of services for children with special needs in New Jersey. Stakeholders that participate in these statewide meetings include all of the state agencies that serve children and families. And there are work groups that are all co-chaired by a family leader and by a state or professional representative. And DEPA co-chairs the early and continuous screening group along with a representative from our Department of Children and Families, which houses our Help Me Grow initiative in our state as well as our Early Childhood Comprehensive Systems grant. These 2 systems integration initiatives align with the work of the Early Childhood Race to the Top grant housed at the New Jersey Department of Education. And Deepa, as the Learn the Signs Act Early Ambassador, participates as a member of the New Jersey team in the Help Me Grow activity. She's the parent lead for both Help Me Grow and the Early Childhood Comprehensive Systems work, and also maintains ongoing communication with the Department of Children and Families to customize and print Act Early materials locally. She also provides updates at our Infant-Child Health Committee meetings and also helps orient parent leaders, new parent leaders who are coming to the Infant-Child Health Committee meetings and support their active participation. And she does those activities, that collaboration with Help Me Grow and the Early Childhood Comprehensive Systems Grant and the Infant-Child Health Committee meetings with financial support from our Department of Children and Families, which is the state lead for those initiatives. Deepa?
New Jersey's Child Development Passport was created through my collaborative work with the New Jersey Help Me Grow and Early Childhood Comprehensive Systems programs. And SPAN is actually highlighted as one of the resources that parents can be connected to. Parents can use this tool along with Centers for Disease Control's Milestone Moments booklet to track their child's health, wellness, and development. This tool includes definitions of developmental monitoring and screening, a well-child visit tracker, a developmental tracker, a notes section to help keep track of child's growth and development for parents, and contact information for New Jersey Early Intervention, Project Child Find, SPAN, which is, of course, New Jersey's one-stop for families with children, and Help Me Grow New Jersey's central phone line, which is 211. The passports are available in English and Spanish. Again, in partnership with New Jersey Help Me Grow, the Milestones brochure from CDC has been customized for New Jersey with contact information for local resources. Again, Help Me Grow 211, SPAN, EI, and Project Child Find are all listed.
And I just want to mention that one of the great things about customizing these materials is that in the CDC version, there's a number to call the Centers for Disease Control, and then they refer you back to your state. But these customized versions, actually families can immediately find the contact information for state resources, including SPAN as the Parent Training Information Center and Family-to-Family Health Information Center.
And this is the other side of the brochure, which has a quick list of key milestones that children should be reaching.
And so we just want to end with a description about the benefits of our collaboration with Deepa as the Learn the Signs Act Early Ambassador to other SPAN programs. Overall, it really helps raise awareness of SPAN as a resource for programs serving young children and their families. All of the work that Deepa does with the home visitors and with the Early Childhood Comprehensive System grantees and with the Help Me Grow partners includes sharing information about SPAN as a resource for them and the families that they serve. For the New Jersey Inclusive Child Care Project, the Early Childhood Challenge Grant added some resources to that project, but also added a focus on training families and early childhood providers on the importance of and strategies for screening. So not just including young children with disabilities in typical early childhood programs, but also about screening. And so Deepa was able to work with the director of our Inclusive Child Care Project to support the development of the new materials that were focused on screening, as well as being able to get tools and resources to share during those trainings. In addition, she can provide copies of the New Jersey customized materials to share with early childhood providers, as well as to get bulk copies of other CDC Learn the Signs Act early materials. And finally, as the Parent Training Information Center and the Family-to-Family Health Information Center, we have great resources to share with families. So we don't just have the option of connecting them to early intervention when their children fail a screen or when they notice apparent developmental delays, but we also have these customized New Jersey materials, including that wonderful health passport that we're disseminating to families. And the work that we did with Deepa also led us as a parent organization to develop a fact sheet for families around what to do while you wait for the results of your child's evaluation. So overall, it's been a real win-win, both for Deepa as the ambassador and for us as a family organization in New Jersey. And we want to thank you and remind you to act early to help children grow. And at this point, I'm going to turn it over to California.
All right. Hi, this is Debbie Sarmento. I'm the one of the Learn the Signs Act Early Ambassadors for California. And Maria, can we go back to the 3 slides that are before Kelly's? And I think I joined the ambassador cohort at the same time as Deepa. So I've had the chance to going into my 5th year now, and I'm very honored to have been able to participate as part of the program. Let's see if they're going to come up. It's always a surprise. Nope. Let's see, maybe I can just go back 3. Let's see. There we go. We'll just do it that way. All right. So I'm presenting today with Kelly Young, who is one of our FRC executive directors. And so I'm going to briefly talk about we're quite different than New Jersey because, you know, we're California and we have to be different than everybody. But in California, we have a state-funded system of 47 family resource centers that work with families who have children birth to 3 with or at risk for a disability. And those 47 FRCs are joined as a membership organization. So my day job is managing that association. So it was really a lovely fit with Learn the Signs when I got to be involved as an ambassador. And 60% of our parent centers are also funded as family resource centers. So Carmen talked a little bit earlier about how there's often different funding streams of the FRCs. So it gave me a really lovely, nice, natural way to introduce the materials into some of our parent centers when I took on the ambassador role. So I'm just going to quickly go over some of the ways we've done some outreach to our parent centers and then turn it over to Kelly and let her talk about it from the parent center perspective. So we've gotten to do a lot of in-person trainings. We do some trainings that are specific to our centers, and then we do some that are more statewide that can pull in a larger audience. Webinars, of course, you know, kind of the way we're doing so much training now. And I love that because, you know, it's cost effective and they're fairly simple to put together, and you can do them multiple times when new things come out. One of the things I did is a direct mailing of as much of the Learn the Signs materials as I could stuff into one of those prepaid envelopes from the Postal Service. And I think it was a pretty cost-effective way to get things into people's hands. The website's fabulous, and I love to hold and touch the materials in my hands, so I really wanted to do that. So we did that with a letter from our California ambassadors introducing the materials and that kind of thing. And if this is preparing for this webinar, has reminded me it's probably time to do something like that again. We also do a monthly newsletter that goes out to our family resource centers where we, you know, keep current on all the new things that are coming out, the milestone tracker, which I had to laugh as I was waiting for the webinar to get started. I got a notification from the tracker that my youngest granddaughter's 4 months old and it was time to do her newest developmental checklist. So it's also to remind Grandma so she won't ever forget a birthday, so I like that. And then Kelly and I have had the chance, because Kelly runs the center that's geographically located closest to me physically, we've been able to do some local presentations together that she brought me into. So, and then we also, of course, will share trainings that our parent centers might be doing, you know, in our newsletters and that kind of thing. So I'm going to turn it over to Kelly and let her tell you about her perspective.
Hi, this is Kelly. Can you guys hear me? Hopefully.
Yep.
Okay, great. So I think Debbie made a great point that in California we are very different from most other states. We have 5 PTI regions, so that's why, let's see, forward. That's why I chose Act Locally, is because each of our centers provides these services in a different way. We all collaborate as networks, and as Debbie said, most of our PTIs are part of our Family Resource Center network, but even though we are a big state, we have a really close collaboration with all of our parent training and information centers. I think as parent centers, we all understand how important it is to identify delays as early as possible so that families can access especially early start resources, early intervention. In California it's called Early Start, early intervention services, because we understand how important it is that in Early Start the family is part of those services, and it teaches parents how to enhance their child's development and makes them part of the team, and gets them ready for special ed if their children continue to need services. So for us, we see, I think all parent centers see the impact of a delayed diagnosis or identification of a delay. It really impacts that child's access to services, and it also, parents walk away feeling that they might not have listened to their voice saying that there was something wrong with them, and it's a heavy burden for a lot of parents to have. So just from our experience, and I think everybody else who works with families, you understand how important it is that families get to this information as soon as possible. We also understand that parents don't always have good, reliable information, especially in these days of the internet, of what their children should be doing. So we've looked at some studies that show that there is, unfortunately, a low level of knowledge on child development. So having these resources really helps parents understand where their child should be. We also love, the Learn the Signs Act Early are incredible resources for any agency and for families. They are easy to understand, they're very informative, and they provide concrete support to parents to understand where their child should be, and also provide great strategies for working to enhance certain developmental domains, especially when they see a delay. So again, as a state, each center does something different. As Debbie mentioned, she's in my area, so we have done a lot of outreach together. As a state, many of our counties are involved in Help Me Grow, and Help Me Grow is supported by, we have something called First Five in California, which we use tobacco money taxes to fund different projects throughout California for services to families that have kids from birth to 5. So we have a lot of collaboration with our First Fives. We also have a very strong Strengthening Families network. Most of our family resource centers have been trained in strengthening families, the 5 protective factors. And of course, one of those factors is knowledge of child development and parenting. So the Learn the Signs publications are really helpful for parents. Let's see. We do locally with Warmline, we have a really great relationship with our region. Before we became a PTI, which we've only been for 3 years, we were Early Start Family Resource Center for over 20 years in 6 counties. Our PTI region is 26 counties. It's pretty large, spread from Sacramento all the way up to the Oregon border. But we have always had great relationships with, especially our child care R&Rs. We have the Mine Institute, the USET here in Sacramento. We have our state, of course, it is the capital, so most of our state agencies are here, so we have great connections with our state. I would say that our PTIs have a really strong connection with our Early Intervention Interagency Coordinating Council, very active there, and we also have a strong presence at our Special Education Advisory Commission. So we have a lot of input with our state. And these resources, again, I would say, especially with the ICC, that Learn the Signs Act Early is something that we discuss with all the different agencies in California that work with families that have young children. So it's kind of become the standard for our state to use these as a means to inform families about their child's development. For me, early intervention is one of the best programs, best laws around for families, for children, and I think alongside of that, the Learn the Signs Act Early is one of the best resources that has been developed to inform parents about child development. So the two for us in California work extremely well together to identify children early and to inform parents on their child's development and the types of activities that they can do to enhance their child's development, and working with all of our local agencies from child care to Head Start to Early Head Start to our healthcare services to physicians to reaching out to the organizations within our community that work with families and providing this information. And of course, going to different outreach opportunities where families gather. So we continue to promote that these are free resources, that people can have their names put on them, and they're great to hand out to the families that they serve. Thank you. I'm handing it off to the next person.
Hi, this is Deborah Jennings again, and we are now at the point where we would like to hear your questions and comments.
Deborah, this is Carmen. I'm wondering if our presenters can address what they found most helpful in terms of forming collaborative relationships in doing this work.
Hi, this is Debbie Sarmento. I think a lot of it really is those relationships that you maybe already have and being able to just look at them maybe in a slightly different way. It's interesting. It's kind of like that pond and the pebble kind of thing, you know, where just recently, as Kelly talked about, we were at the Interagency Coordinating Council, and I went up to talk to head of a state agency, and she said, oh, I've been wanting to talk to you. And it wasn't, you know, it was other people are doing that work for me sometimes, you know, because they're hearing about it and then they're sharing it. It's kind of that, everybody, there's such great materials that people are sharing about them. And you just have to be out there, you know, kind of being able to connect those dots, I think. Because let's face it, the materials speak for themselves. Are so great. And you just have to get them in front of people, I think, and then they just kind of do the work for you.
Great.
This is Diana, and of course, so Deepa, you know, was already a staff person, and I really, any family organizations that are on this, you know, webinar, if future opportunities arise to, they're small pots of funding that are available to support the Learn the Signs Act Early work, but it really does enhance our work as both a PTI and a family-to-family health information center. Deepa is a great, you know, it's wonderful to be able to find the resources on the website, but Deepa is such a great conduit of information and making sure that everybody is aware when new resources are developed, and even having the opportunity to review and comment on you know, proposed resources from the perspective of a parent and a family organization. So that has been a real value add to our organization. And then I think, you know, as Deepa mentioned, we're able to really expand the reach of the Learn the Signs Act Early Ambassador because we have other projects and other ways in which we can disseminate materials and other staff throughout the state and other partnerships with other organizations like federally qualified health centers or early childhood programs that we partner with, where we can really get the resources and information out there to a very, very broad audience.
Great. So if a parent center hasn't contacted their ambassador yet, or alternatively their ambassador hasn't contacted their parent center, what do you all recommend is the first step?
This is Kelly. I think it's a natural collaboration, and pick up the phone right now. Call them. Don't delay. I think it's just perfect collaboration is because we are, as a parent center, we're already doing a lot of outreach to the organizations that work with families that have young children, and having access to the ambassador really increases our effectiveness, and we have access to all that great information. And as was already mentioned, anytime anything new comes up, the ambassador is able to update us.
This is Deepa. I agree with Kelly in that, if you are a parent center, get to know your ambassador, and if you are an ambassador, get to know your parent center, because our missions are similar, and aligning our efforts will only result in increased and enhanced outreach to families and other organizations that we all want to reach.
And this is Julia. I just wanted to chime in on a more logistical note. So 45 of our ambassadors, I think you can find their email addresses and names on our website, but as I mentioned, we've added just this week, selected 11 new ambassadors, so you can reach out to us directly here at CDC, and we can put you in touch if you don't see your ambassador listed on our website right now. Or just keep checking back, and the most current information will be posted soon.
Great.
And Julia, this is Deborah. We will make sure that parent centers are easily able to access that information through the Parent Center Hub.
Oh, great.
And we'll make sure that it's posted along with the recording of this webinar as well.
Good. Yeah, let's make it easy for people.
So this last bit of time, we'd really like to get some suggestions from each of you about what other states might do in terms of getting their collaborations going. I think we talked a little bit about it in the Q&A, but you may have some more suggestions or insights.
This is Diana, and I think one of the things that has been really, really valuable is the ability to customize the Learn the Signs Act early materials, and having DEPA to really kind of lead those efforts in collaboration with other state agencies that are working on early childhood initiatives. And so one tip would be to have a meeting between the family organization and the Learn the Signs Act Early Ambassador to talk about how what materials might be most effective to be customized and how that process might happen, who might be able to support the printing of state-specific customized materials. We're also happy to share the developmental well-child visit passport that we developed here in New Jersey, and we've already shared that with some family organizations, and so we can share it in a format where you could customize it for your state. But I think looking at customized materials is a really good place for parent centers and other family organizations to work with their Learn the Signs Act Early Ambassador.
Great, thank you, Diana. Anyone else?
This is Debbie Sarmento. I think Kelly
I have one other recommendation too. It kind of goes on to what was prior said as far as customizing the information. and Debbie was involved in this project too. We have another group called Captain in California, and they went through and put several different agencies on the materials so that families had an array of phone numbers to call. I think depending on where you live and what kind of collaboration you have, it might be more appropriate to have that range of agencies, or, if you prefer, the one-stop call at the Parent Training and Information Center. So thinking about the broader range of agencies that might be good collaborators also.
And Deborah, you have something you wanted to add? Mm-hmm.
Yeah, I would. Well, it's just I sort of reiterate what this is Debbie Sarmina that Kelly had said is pick up the phone. Set up a meeting if you guys are in a small enough area that you can travel together and just sit down with the materials. And I think Carmen mentioned earlier too that the child find aspect of the materials is so great. That really helps people, organizations meet those goals of child find. And like Kelly said, it's such a natural fit. It's just an easy fit, and I think you just got to be sure people know about it, and then it just kind of rolls on.
Yeah, that's what I really appreciate about this conversation is the ease of the collaboration, because some collaborations aren't so easy, but this one is really, as you said, just a natural way for us to connect each other and connect with each other, and really to maximize all of our resources that are, not so great or somewhat limited, but to really, work together to be able to have a much greater impact in each of our states. It really sounds like something that all of us should work towards, ambassadors as well as parent centers. Any final suggestions? So just to let you know, we have recorded this webinar, and we will be posting the webinar recording along with resources, as many of the resources that our presenters have mentioned. We'll be able to post those along with the webinar, and also you'll be able to find them in parentcenterhub.org. And we'll have a special web page just for this, for today's webinar. Finally, I just want to acknowledge and thank each of our presenters today. It's always great to hear how people are working together across organizations, across different systems, to really be focused on helping to make children's and families' lives much better. And so I really want to thank each of you and congratulate you in your work, and let you know how much we appreciate you, and all of us that have been able to participate in this conversation appreciate your efforts. And as always, I'd like to thank our team here at the Center for Parent Information and Resources, and I would look forward to each of you joining us in our future events. So again, thanks to everyone, and have a wonderful afternoon, and keep the work moving for our children. Thanks.
And lastly, Deborah,